हमने पिछले वीडियो में देखा कि व्हाट इज चैलेंज और हैंडीकैप चाइल्ड. वी हैव सीन ऑलरेडी टाइप ऑफ चैलेंज चाइल्ड or handicapped child. That is, first is physical handicapped child, mental handicapped child, or social handicapped child. We are going to see physical, a particular first one type of handicap or challenge child, that is physical handicapped child. That is also, we can say, affected part of the body. When a child is affected, any deformity or any malfunction, any problem in affected to his or her body, that is physically challenged or handicapped child. Okay, then four subtype comes under this physically handicapped child. First one is orthopedical, then next one is sensory, third one is neurological, and fourth one is, that is also chronic systemic diseases. First one, it includes foot club. Foot club, that is a twisting of foot. Like someone has a twisted foot, that he or she can't place flat foot like a normal person. That is a foot club. Then rickets, fracture, any fracture, then amputation, maybe limbs and else. Then accidental injury due to trauma or any accident, motor vehicle accident maybe. Then arthritis or leprosy. These club foot, rickets, fracture, amputation, accidental injury, arthritis, and leprosy, all these comes under orthopedical type of physical challenge child. Okay, then second one is sensory. Sensory, that is visual, maybe partial. This is partial, and then complete. Complete, that complete is blindly, like blind, blindness, fully blindness. Then again auditory, visual, visual, that is partial or complete. Incomplete, that is blindness, fully blindness. Then auditory, that also partial, maybe partial, or then maybe complete, like deaf. Okay, then neurologically, that may be speech, any type of speech difficulty, like stammering. He or she can't continue her flow or rate to speak, like stammering. Then seizures may be there, that is stammering. Then dysphonia. Phonia means a sound that is produced by a coordination of our mouth, tongue, or vocal cord. And okay, then it means phonia, that is phonia. And dysphonia, it means it is not produce a sound by coordination of mouth and then tongue or vocal cord, that is dysphonia. Okay, then chronic systemic disease. Okay, so that is blindness. Blindness, main is blindness, deafness, dumbness, or orthopedical handicap. That we can say the person or children is actually handicapped. There are some test or some diagnostic test. We diagnose test and then evaluate them, and then we consider them as a challenge or a handicapped child. So first, blindness, that has a visual acuity test, that is visual acuity test. Acuity is a sharpness or keenness to see. Like I can see this pen sharply and keenly, that is acuity. So visual acuity test less than 3/60. Okay, we use Snellen chart, that is Snellen chart, or inability to count finger in daytime at distance of 3 meter. Like we will place like we will taste a test in which a person is unable to count finger in daytime, like in daytime, at distance of 3 meter. If he or she is unable, he has inability or she has inability to count how much finger is another person is showing, then we can consider them as a blind, that differ as grade. Okay, then next is deafness. uh, their hearing loss greater than 30 decibel. If a person has or a children has hearing loss greater than 30 decibel, that then he or she is deaf child. Okay, it may be congenital. In congenital, there are genetical factor or some mutations, genetic mutation, and like anything that is passed from one generation to second generation, that is genetic disorder or genetic mutation due to radiation or something else. And then acquired intrauterine infection. If a mother has a infection in uh, intrauterine fetal stage, it can lead to deafness. Okay, then dumbness, that is a mute, like a child cannot speak fluently or cannot produce sound. Okay, if they cannot speak oral language, like how I'm talking like that, if a child uh, talk orally, cannot talk oral language, that means he or she is dumb. Okay, we can consider him as a dumb, or some degree of speaking disability that maybe comes in partial. Okay, then impairment of speech or sound production, fluency, rate, that depend. Then orthopedically handicapped. We have already seen that orthopedically handicapped, that means a child has any type of problem with the bones, that may consider as a orthopedically handicapped. It's especially poliomyelitis, polio, that bone TB, like spinal tuberculosis or TB related to bones. Then cerebral palsy, then amputation and fractures and burns with cause contraction. A type of burns or severity of burns which induce or cause contraction, we can consider as a orthopedical handicapped child. Okay, thank you. We have already seen first type of handicap or challenge child, that is or physical handicapped child. We will see another next mental handicapped child in another video. Thank you. Stop.